Hello, I'm Dorothy Wilson. I am a nurse practitioner with North Mississippi Medical Center in Tupelo, Mississippi. I work with the electrophysiology department and care for patients in our clinic and hospital system. Today, let's talk about atrial fibrillation. We'll define what atrial fibrillation is, what causes it, the consequences, and how we treat it. To start with, what is atrial fibrillation, also commonly called A-Fib? Is an irregular heart rhythm that originates in the atria, or the top chambers of the heart. The upper chambers beat out of rhythm with the bottom chambers, with the top chambers quivering. Atrial fibrillation is the most common heart arrhythmia. The prevalence of atrial fibrillation in the United States ranges from about 2.7 million to 6.1 million, according to the Centers for Disease Control. Additionally, the CDC estimates 12.1 million people in the United States will have atrial fibrillation by 2030. Atrial fibrillation is more common in individuals of European descent versus African Americans. More women than men will have atrial fibrillation. This is due to the longer lifespan of women. Additionally, the risk for atrial fibrillation increases with age. Patients report various symptoms with atrial fibrillation. Palpitations are sometimes described by individuals as an irregular heartbeat, fluttering of their heart, or skip beats. Some report shortness of breath both at rest and with activities. Other symptoms some individuals will report are dizziness, fatigue and weakness, or discomfort in the chest. Some individuals will have no symptoms with atrial fibrillation, and it is found incidentally on a routine exam. Atrial fibrillation may be caused by various health or environmental issues. Some health issues include high blood pressure, heart failure, cardiomyopathy, coronary artery disease, heart valve disease, previous heart surgery, congenital heart disease or birth defects involving the heart, chronic lung disease such as COPD, asthma, and emphysema, or a blood clot in the lungs, also known as a pulmonary embolism, and thyroid problems. Environmental issues that can cause atrial fibrillation include excessive caffeine consumption, excessive alcohol intake to include binge drinking, and stress. However, in some individuals, there is no known cause of their atrial fibrillation. There are various treatments available for atrial fibrillation to help with the symptoms. These include medications to help maintain a normal heart rhythm, to include a class of drugs known as antiarrhythmics. Sometimes a cardioversion or shock to the heart is needed to restore the individual to a normal heart rhythm. When medications are no longer effective, then an outpatient ablation may be done to target the source of the chaotic electrical impulses in the heart, typically performed by an electrophysiologist. For some individuals undergoing open heart surgery, a maze procedure may be considered, where the surgeon creates scar tissue in the upper chambers of the heart. Sometimes permanently implanted devices such as pacemakers or loop recorders are used to help manage atrial fibrillation. It is important to understand the consequences of atrial fibrillation. Atrial fibrillation increases stroke risk. An individual with atrial fibrillation is 5 times more likely to have a stroke than someone without atrial fibrillation. As the heart is not squeezing properly, it allows blood to pool in the upper chambers of the heart, creating the opportunity for blood to clot. These blood clots can then move out of the heart and travel to the brain, blocking blood supply, causing a stroke. Additionally, atrial fibrillation can lead to heart failure when heart rates are uncontrolled. This is due to the heart not efficiently pumping blood to the lungs and body. With the increased stroke risk with atrial fibrillation, prevention of stroke is very important. Traditional oral anticoagulation, also known as blood thinners, are used. They increase the time it takes for blood to clot. More recently, other options for stroke prevention have evolved. In patients where long-term anticoagulation is problematic due to falls, unsteady gait with significant risk for falls, unable to maintain therapeutic INR, or recurrent GI bleeding, there is an alternative to traditional oral anticoagulation. In people with atrial fibrillation, more than 90% of stroke-causing clots come from the left atrial appendage. Devices to occlude this area have been developed. The device is placed in the left atrial appendage, a small area on the upper left chamber of the heart. The Food and Drug Administration has so far approved 2 devices, the Watchman and Amulet devices. Watchman is made by Boston Scientific, and Amulet is made by Abbott Medical. Watchman was the first FDA-approved device, gaining approval in 2015, and Amulet was approved in 2021. There are other devices currently in research trials. For further information about atrial fibrillation may be found online at American Heart Association, American College of Cardiology, and Centers for Disease Control websites. Further information about left atrial appendage closure devices may be found online at their respective manufacturers' websites. So if you or a family member would like to discuss your options for atrial fibrillation further, you can either have your primary care provider refer you to electrophysiology or call and make an appointment as no referral is required. Patients are seen at the Tupelo, Corinth, and Oxford clinics with our procedures performed at North Mississippi Medical Center in Tupelo. Please call 662-620-6800 to schedule your appointment. Thank you for your time today, and I hope you have a great day.